Thank you, Madam Speaker. Today I'd like to share a letter I received from Sherry, who lives back in my hometown of Olympia, Washington. And Sherry writes to me, "My husband was a veteran. He worked as a civilian with high security clearance at White Sands Missile Range and later as a paramedic and firefighter. When I met him, I was working as a paramedic also. We were crazy in love, but I lost him to cancer in 2009 at the age of 56. Since the day my husband died, we lost his income. I had to figure out how to raise our son, who was then 6. I sold my business on the Oregon coast, lost my house in Newport, and moved to Washington to be with my sister. I found Olympia a year later and have been here since. I have qualified for food stamps for the last 8 years. We've depended on the food bank on and off. When all this happened, that was before Obamacare, and the $1,000 monthly premium for insurance for my family was simply not sustainable. At first, I was able to keep my insurance through COBRA, but after that ran out, we were left to paying for some cut-rate insurance that provided very little coverage. When the Affordable Care Act was enacted, I finally felt relief. I got covered through the ACA, and that allowed me to direct some of the money I was paying to insurance toward food, books, clothing, or tuition. Well, my son is now 13 and 6'1" with a size 14 shoe. So we go through clothes and shoes for him like crazy. I still struggle. I still have medical bills and collections. I still struggle with food and clothes for both myself and my son. I still go to the Thurston County Food Bank in downtown Olympia. But Obamacare allows me to follow my health closely and helps me pay for the medical care for my son and that which I require. I have a spot on my lung, and that needs constant monitoring. And Obamacare has allowed me to go in for those routine MRIs. Preventative services like mammograms are also paid for. Since my husband died, I've been focused on raising my son and getting a higher education degree. I went to massage school, and then I earned my degree at the Evergreen State College. I'll graduate with a master's degree in psychology in August. Not only will I be employable and be able to help others in the mental health field, I will also get to start whittling away at paying old medical bills and my student loans. Although I will no longer need Obamacare since I'll have health insurance through my employer, the ACA has forever changed the insurance marketplace. The insurers can't charge me more for my pre-existing condition like they could before. If the ACA had been in place when my husband died, I would have been able to keep my business on the Oregon coast. If the ACA had been in place when my husband died, I would have immediately qualified for insurance under the ACA, and I may have been able to keep our house. I want you to know I am not lazy. I am a determined, self-improving mom who is raising her son alone. Before the ACA, I had to decide whether to pay for insurance or food. I depend on the ACA. That's the letter from Sherry. Well, Madam Speaker, this past Saturday, I had the opportunity to meet with more than 300 of my constituents who support accessible, affordable health care in our country. I heard from many, but still a small portion of the 750,000 Washingtonians who gained coverage through the ACA. The ACA is working for many people across America, and Congress should not reverse the progress we've made under it. That being said, I know there are parts of the ACA that could be improved upon. We all know that. We can and should make improvements in order to make health care insurance more affordable and more accessible to more people across our nation. As we began this Congress, I had hope that we could have a productive bipartisan discussion about the steps we could take to do just that. But I was saddened and frankly dismayed by the lack of serious policy efforts from my friends on the other side of the aisle. Well, the majority finally released their proposed replacement for the ACA, the so-called American Health Care Act, after weeks of hiding the secret bill behind closed doors. And frankly, I'm not impressed by the bill. This bill offers no attempts to improve health care coverage or insurance coverage, no attempts to reduce health care cost or the rate of inflation. This bill allows insurance to charge older people more while at the same time reducing the subsidies for many of those very same people. The bill was presented without any indication of how it will affect our budget or how many people will be kicked off their insurance under this plan. This bill does not address the barriers that prevent working class and middle class people from accessing and securing health insurance. In fact, the bill would likely put health insurance out of reach for millions of Americans who are working and middle class. Madam Speaker, to earn the label American, a bill had better be exceptional. The American Health Care Act is a lot of things, but exceptional is not one of them. People like Sherry are exceptional. Let's put Sherry and people in her circumstance first. Thank you, Madam Speaker, and with that I yield back to balance.
The gentleman's time has expired.